This is Mpondwe in western Uganda at the border crossing with the Democratic Republic of Congo. And here, security agencies have started enforcing the measures to restrict the movement along this border to contain the spread of Ebola. Many travelers from the DR Congo side of the border who were attempting to enter Uganda were turned away as authorities here intensify screening and surveillance measures. Security agencies have also been deployed along the porous borders, mostly here in Uganda, to curb the unauthorized movement of people between these two countries. The enforcements come after Uganda announced it was temporarily closing all its borders with the Democratic Republic of Congo following an escalating outbreak of Ebola in DRC. The closure of the borders with the Democratic Republic of Congo affects all passenger movements except a few limited categories, including Ebola response teams, security personnel, and movements for cargo, as well as humanitarian reasons.
Certain practices, including touching the bodies of those who have died from Ebola, can spread the virus further. While we grieve for those we have lost, we must do everything we can so that we do not lose another and get into a cycle of grief.
Ebola is spreading. I wanted to give you some updates. According to the World Health Organization, the number of people suspected to have Ebola is around 900 or more, and the suspected deaths from Ebola is estimated to be around 220. And one of the things about those numbers you should keep in mind is the World Health Organization has, and other organizations have repeatedly said that they feel like we've gotten a late start, a late jump on this virus. They suspect it had been spreading for a while before cases were picked up. So the suspicion is that cases are likely even higher than that, perhaps deaths even higher than that as well. I encourage you to read some of the news stories about what is going on in Democratic Republic of Congo and other neighboring countries in Africa, so you can understand the different dynamics that are impacting this Ebola outbreak. They are numerous. Right now, the risk to the United States is still low, but it is something that we need to be aware of and we need to be mindful of and just sort of keep an eye on. You don't need to be scared, but you do need to be informed.
This Ebola outbreak could turn out to be one of the worst ever, and at least one of the reasons for that is the lack of US leadership. To understand why people are so alarmed, just take a look at this photo from the eastern part of the Democratic Republic of Congo where the virus is spreading right now. And what's striking is what's missing. Normally, if you see people dealing with a suspected Ebola case, you'd see them wearing full body gear, and these people are barely wearing face masks. I've spoken to people who are on the ground right now, and they say that lack of protective gear is the biggest problem they're facing. We know what it takes to stop an outbreak, even an Ebola outbreak. You need good testing, you need a vaccine, you need treatments, you need a good healthcare infrastructure, you need ability to do contact tracing, and you need genetic analyses. That's working well so far. Scientists have worked very quickly to analyze the virus, and so far they seem to think that it has not really changed since the last time it was seen. But without US support, a lot of things have been weakened. In past outbreaks, USAID was on the ground making sure that protective gear was available to people within hours of learning of an outbreak. But this time, USAID doesn't exist anymore. They would have been there to make sure that lab samples were being transported in the correct way. They would have helped with contact tracing. They would have helped train healthcare workers. And CDC would have been there to provide medical expertise to make sure that the science was first rate, to communicate with international partners on things like vaccines and therapeutics, and to make sure that the best medical guidance was available to everybody. But CDC has been stripped of thousands of workers, including hundreds who worked on infectious diseases. Now, they do have a country office in Congo still, but My reporting shows that they have 7 unfilled positions, including some top leadership positions. Those are people that would have been extremely helpful in an outbreak like this. The US has also cut funding to the World Health Organization and to a lot of the international partners who are doing work on the ground. So the organizations that have done this for decades, that know how to deal with an Ebola outbreak, are all under-resourced and understaffed. Because the US is no longer part of the World Health Organization, US officials did not find out about the outbreak until 9 days after all other countries knew about it. Once the US found out about this, they did start to mobilize some money, and the State Department has said that it is already providing $23 million in assistance to the countries that are affected. They have said that they are committed to giving all of the resources required to contain this outbreak, but even if the money gets there quickly, the people who actually know how to do this work are missing in large numbers. I've talked to several people who have worked on past Ebola responses who are watching horrified as these case numbers go up and knowing that the things that they would have been doing to help are probably not happening right now.
There are now more than 500 suspected cases and more than 130 deaths linked to this Ebola outbreak in Central Africa, and it is showing no signs of slowing. The Director General of the World Health Organization declaring a public health emergency, warning he's deeply concerned.
I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations, after consulting the ministers of health of both countries, and because I'm deeply concerned about the scale and the speed of the epidemic.
American authorities confirmed an American doctor working in the Democratic Republic of Congo has tested positive. He is now being treated in Germany along with a group of high-risk contacts who will isolate there. American authorities have also banned anyone who doesn't have a US passport entering the United States who visited impacted areas in the last 21 days, including the Democratic Republic of Congo, South Sudan and Uganda. Now, this particular strain of Ebola spreads through bodily fluids. There is no vaccine, and health authorities are racing to get to the area, get more tests in there and try and stop transmission.
So you're seeing news about an Ebola outbreak in the Democratic Republic of Congo and Uganda. But what is Ebola, and what does it do to the body? Well, Ebola is a viral hemorrhagic disease. It's caused by a group of viruses known as ortho-Ebola viruses. That term, hemorrhagic disease, sounds serious, and it is. It means that this is the type of virus that affects many of your organs, including your cardiovascular system. And it may also interfere with your body's ability to clot, and that can lead to bleeding, hemorrhage. Ebola virus is primarily found in sub-Saharan Africa and can have a mortality rate of up to 90%, but the World Health Organization says the average is around 50%. There are 4 different types of the virus known to infect humans. The type causing this outbreak in the DRC and Uganda is called Bundi-Bujo, and there is no specific treatment or vaccine. Ebola spreads through direct contact with fluids from an infected person. So that means you can come into contact with an infected person's blood, vomit, fecal matter, or even a surface or object that's been contaminated with one of those things. But here's a big difference between infectiousness and contagiousness. Ebola is not very contagious, meaning you're not likely to catch it through quick or casual interactions. But it is extremely infectious, meaning just a few drops of the virus can get into your body through a cut, for example, and that can cause infection. According to the CDC, symptoms can appear up to 21 days after exposure, but the average is around 10 days. These symptoms are typically broken down into 2 phases: dry symptoms and wet symptoms. Dry symptoms, they usually begin early in the illness. They include fever, headache, sore throat, aches and pains, fatigue. As the illness progresses, those infected can experience wet symptoms, which may result in things like diarrhea, vomiting, and unexplained bleeding. People who die from this disease usually experience the more severe symptoms, those wet symptoms, earlier after exposure. One of the many challenges with Ebola is that it can be difficult to diagnose. In the early stages, it can often resemble things like malaria, typhoid, meningitis, even other viral hemorrhagic fevers. And testing can be difficult, especially in some of these remote areas of Central Africa where the virus is currently spreading. The World Health Organization says it warrants serious concern, but global risk at this time remains low.